Hello, today I'd like to introduce Bridget Allan from the Te Awakairangi Health Network. And Bridget, I'd like to ask you a bit about the organisation and what you do and what you're here for. Thank you.
Great. So Te Awakairangi Health Network, we're a Hutt Valley organisation. We're very focused on working and supporting our community. 117,000 people, a real microcosm of New Zealand, Māori, Pacific, a range of socio-economic status, and a really diverse and vibrant community. So our role as a primary care network is to actually provide really good primary care services, and we do that in a range of ways. Mm-hmm. We have 23 general practices who are the core place that people can go for service. But supporting them, we also have some other teams who look after people in a number of ways. We have community health workers, we have outreach nurses, we have a primary mental health team, we have a small health promotion team who really help our whole community to be healthier. And as a network, we also link much, much more widely with the whole of the Hutt Valley, whether it be our city councils, it be our runanga, other providers in the health sector and the social sector area. So we've got a really diverse community and we link to it in really strong
So you're a bit of a hub. The network is about being the hub and you're connected into all these organisations, whether they're health or other sort of social service or community organisation.
Yes.
And you reach
good.
along
Got
that.
it.
Thank you. And what do you actually do?
So we actually provide a whole lot of services for people.
Yes.
But to make those general services, whether they're general practice or other service teams, work effectively, we need some systems that underpin what they do. Mm-hmm. And we have one team, our program and practice development team, who really look at how to make all that hang together. If there's a new issue that we need to address, whether it be rheumatic fever or preventing cardiovascular disease, improving diabetes care, that team actually put together a new way of doing things, work with our practices and other organisations to put that in place and make it work. And then they monitor how's it's going and is it making the difference that we need on the ground.
And the sort of goals that you're working towards for the community?
Well, the vision that our board has is really a healthy Hutt Valley for everyone. And we want to do that by providing some leadership on the ground through all those relationships we were talking about before, by being smart about how we do things, about using resources that are available to us and our communities really effectively. And we want to do that in ways that are very people-centred. And I think we actually are achieving that. When I talk to the teams of people we work with and our own internal teams, that's what I hear, the stories about us serving people really well. And doing that with a real focus on excellence and on working cooperatively.
Yeah. Is that what you could say you're most proud of in the organisation? You have 35 people here
and 100 GPs and 100 practice nurses and so on. And yes, I think the thing that I'm most proud of there is the commitment they've got to serving people.
Yep.
And actually, the other thing I really like is we have quite a lot of fun doing it too.
That's great. And what is it that you look to achieve in the next while? What will success look like for you in the next 12, 18 months?
Yeah. So at a broad level, we want to really make a difference for our community. We know that if we can get more people getting heart checks done, we'll find some of them who actually need more support to actually bring their blood pressure down, perhaps get their diabetes under control, whatever. That will mean they have a better quality of life, they live longer, they're there for their children and their grandchildren, and our whole community can use them and their skills going forward.
Yeah.
We can make a real difference there. Sure. Really keen to make a difference for children as well. We already have a really good immunisation program which is working really effectively, but we also know there are vulnerable children in our community, and actually our wraparound services for them and their families. If we can make a difference there, that's really important. So making a difference for our people, our population, that's the core thing. But to do that, we have to be a really strong network and support our general practices and our other providers to do their job effectively. That's where those systems I was talking about come into play. And then, of course, as any health-funded organisation, you've also got to be able to show that you're doing what you should be doing. And so it's really important that we are being and recognised as being an excellent performer. And I'm really pleased to be able to say we're actually making some significant improvements in what we do, and we're always looking for good people to come and join us and help with that.
Right, lovely. Thank you, Bridget. Thank you for sharing that with us today.
Thank you, Leigh.